Welcome back. Right now we are going to turn to your health. I recently spoke with a patient who has chronic kidney disease. She shared her journey and her story and hopes to help people be able to manage this disease. Let's take a look.
Roughly 1/3 of all Americans are at risk of developing chronic kidney disease, or CKD. Rarely does this condition present any symptoms in its early stages, resulting in up to 90% of people diagnosed not being aware that they have it. In serious cases, a patient will need dialysis and even a kidney transplant. That's the situation for our guest, Roshanda, a kidney care patient at Fresenius, who joins us now to talk about managing the disease and the importance of early diagnosis and treatment choice. Roshanda, thanks for joining us.
Thank you very much for having me.
What can you tell us about your diagnosis of chronic kidney disease?
So what I can tell you is that statistic that you mentioned, I'm part of it. I was one of those people who had no signs and symptoms that I was aware of was even related to chronic kidney disease or renal failure. I was pregnant with my second child, and when I was diagnosed initially with kidney disease, I had a long history of high blood pressure, and I didn't really know that there was anything going on until I landed myself in the ER. Other than fatigue, which is one of the symptoms, that is the only thing that I had. So what I want people to understand is that, one, there's a few signs and symptoms that you can look out for. Frequent urination, fatigue, which is what I had, shortness of breath, itching and swelling of your hands and feet are just a few of the signs that you can look out for that may be related to you being at risk for chronic kidney disease. But what some other things I want you to be aware of is that there's a chance you may not have any signs and symptoms, especially if you have high blood pressure combined with diabetes. You will have no idea that this may be going on. So what I urge you to do is I urge you to talk to your healthcare provider and get screened before symptoms even present themselves.
How are you managing your disease today?
Well, I'm able to manage my disease in a way that has been extremely amazing for me. I'm doing home hemodialysis, and I'm able to complete my treatments on my own. I'm allowed to, be flexible. I have the freedom and the flexibility to be available for my family and for my friends. I am doing what they call solo home hemodialysis. And basically what that means is that I do my entire treatment by myself. However, I'm not alone. I have a care team at Fresenius that has trained me to be able to do this treatment. They have given me the confidence, the information, and the knowledge to be able to complete my treatments on my own. In addition to that, there's 24-hour nursing and tech support that's always available to be able to assist, which helps me to manage my dialysis at home.
What can others learn from your experience?
So first of all, I want people to understand that it's just that. This is my experience, and your experience very well may be different. What I want you to do is I want you to talk to your healthcare provider. Find out what the best treatment is for you. The information that I'm trying to give you is to be an advocate. I'm trying to give you some knowledge so you know exactly where you can go and how you can get screened. I want you to start asking why. When you go see your doctor, ask him why when they're giving you information that you just don't understand, and continue to do that until you get the answers that you need. In addition to that, I encourage you to be loud. Be loud about what you need for your health. Be loud about what it is that you expect and what it is that you deserve. And that's really going to be your life, right? It's for you to be in charge of your own life. And I think that's the biggest message for me to pass on.
What is most important advice that you can provide to others at risk or someone going through a similar experience?
So if you believe that you are at risk for chronic kidney disease, my biggest thing, and I can't urge this enough, is get screened. Go and get screened. It's a very simple urine or blood test that you can do and you can have completed with your healthcare provider. In addition to that, I tell people to be kind to themselves. It's really important that you give yourself time and space to feel whatever it is that's going on with you, and then to be able to absorb that and push forward. And for more information in the meantime, if you're not able to get to your healthcare provider, or you're just not sure and you want to see those signs and symptoms in black and white, I would tell you to go ahead and check out freseniuskidneycare.com. There's going to be videos, there's going to be information on screening. You can also meet other patient advocates such as myself who may be able to answer any other questions further. So again, that's freseniuskidneycare.com.
And is there anything else, Roshanda, that you'd like our viewers to know about chronic kidney disease and your experiences?
I would just want them to know that it's not the end. It's really not. There's so much technology has grown from 1960, and I want them to know that it's okay to go get screened and to ask questions and to be an advocate for yourself. So I just want to thank you very much for having me. I appreciate it.
Well, thank you so much, Roshanda, for joining us here on Park State Television, this important discussion about chronic kidney disease. And I so appreciate you being vulnerable and sharing your experiences.
Thank you.